Hello and welcome back to the channel. As you already know, the Medicare enrollment season is about to begin, running from October 15th through December 7th. This is the time of year when millions of Americans take a closer look at their healthcare coverage, review their options, and make important decisions for the year ahead. Today we're diving into one of the most important topics when it comes to Medicare, enrollment periods. If you or a loved one are getting close to 65, already on Medicare, or thinking about switching from original Medicare to a Medicare Advantage plan, then understanding enrollment windows is absolutely crucial. Missing these deadlines could mean paying lifelong penalties, losing out on coverage, or getting stuck in a plan that doesn't really fit your needs. But don't worry, by the end of this video, you'll have a complete, clear understanding of all the key enrollment periods, how they work, what you can do during each of them, and some smart tips for avoiding common mistakes. Let's start at the very beginning. Medicare has several different enrollment periods, and this is where many people get confused. There's the initial enrollment period when you first become eligible, the general enrollment period if you miss your initial window, the special enrollment periods that apply in certain circumstances, and then the ongoing annual enrollment period and Medicare Advantage open enrollment period. Each one has its own rules, its own timing, and its own consequences. So let's go step by step. When do you first become eligible for Medicare? For most people, eligibility begins when you turn 65. Your initial enrollment period is a 7-month window that starts 3 months before your birthday month, includes your birthday month, and continues for 3 months afterward. For example, if your birthday is in June, your initial enrollment period would run from March 1st through September 30th. During this time, you can sign up for Part A, which covers hospital insurance, and Part B, which covers medical insurance like doctor visits and outpatient care. Most people qualify for premium-free Part A if they or their spouse paid Medicare taxes for at least 10 years, but Part B always comes with a monthly premium. Now, if you're already receiving Social Security benefits when you turn 65, the good news is that enrollment into Medicare is usually automatic. You'll get your red, white, and blue Medicare card in the mail a few months before your birthday. But if you're not yet drawing Social Security, you'll need to actively sign up through the Social Security Administration. This is a step a lot of people miss, and missing it can cause major headaches. Why? Because if you don't enroll in Part B during your initial enrollment period and you don't qualify for a special enrollment period, you may face a late enrollment penalty. That penalty adds 10% to your Part B premium for every full 12-month period you could have had Part B but didn't. And here's the kicker, that penalty is permanent. It stays with you as long as you have Medicare, which usually means for the rest of your life. There's a similar penalty for Part D prescription drug coverage if you go more than 63 days without creditable drug coverage after becoming eligible. So the key takeaway here, don't miss your initial enrollment period unless you have other coverage that qualifies you for a special enrollment. Speaking of which, let's talk about special enrollment periods. These exist to help people who have a valid reason for delaying Medicare. For example, if you're still working at age 65 and you're covered by your employer's group health plan, you don't have to enroll in Part B right away. When your employment or that coverage ends, you get an 8-month special enrollment period to sign up for Part B without penalty. Another common example is if you move out of your Medicare Advantage plan service area. That qualifies you for a special enrollment period to choose a new plan. There are dozens of different scenarios that can trigger a special enrollment period, such as losing Medicaid eligibility, moving into or out of a skilled nursing facility, or if Medicare terminates your current plan. The key point here is that special enrollment periods give you flexibility, but they're not unlimited. You need to know the rules for your specific situation. Now, let's say you missed your initial enrollment period and you don't qualify for a special enrollment period. What happens then? This is where the general enrollment period comes in. It runs every year from January 1st through March 31st. During this time, you can sign up for Part A and/or Part B if you missed your initial chance. But here's the catch, your coverage doesn't begin immediately. Until recently, coverage would start July 1st, but beginning in 2023, Medicare made this more flexible. Now your coverage starts the first of the month after you enroll. Still, you may owe late enrollment penalties, and you'll have to pay them for as long as you have Medicare. So far we've talked about getting into Medicare in the first place, but what about people who are already enrolled and want to make changes? This is where the annual enrollment period comes in. The annual enrollment period, sometimes called AEP or the Medicare Open Enrollment, happens every year from October 15th through December 7th. During this time, you can make a wide variety of changes to your Medicare coverage. You can switch from original Medicare to a Medicare Advantage plan, switch from Medicare Advantage back to original Medicare, change from one Medicare Advantage plan to another, or change your Part D prescription drug plan. The changes you make during the annual enrollment period take effect on January 1st of the following year. This period is extremely important because plans can change their premiums, co-pays, provider networks, and covered drugs each year. Reviewing your plan annually ensures you're not caught off guard in January with higher costs or fewer benefits. In addition to the annual enrollment period, there's also the Medicare Advantage Open Enrollment period. This runs from January 1st through March 31st each year. It's specifically for people who are already in a Medicare Advantage plan. During this window, you can switch to another Medicare Advantage plan or drop your plan and go back to original Medicare, with or without a Part D drug plan. What you can't do during this time is join a Medicare Advantage plan if you're not already in one. That's what the annual enrollment period is for. This is more like a second chance window for people who chose a Medicare Advantage plan in the fall but realized after a couple of months that it's not a good fit. Let's pause here and talk about some real-life examples, because sometimes these enrollment rules sound complicated until you see how they play out in actual lives. Take Mary, for instance. Mary turned 65 in May, but she was still working and had excellent coverage through her employer. She decided to delay enrolling in Part B to avoid paying an unnecessary premium. 2 years later, she retired in June. Because she was covered by her employer's plan the whole time, she qualified for a special enrollment period. She had 8 months after retiring to sign up for Part B without a penalty. That's a smart move. Now let's look at John. John also turned 65 in May, but he didn't have employer coverage. He assumed he could wait until he needed it. When he finally tried to sign up at age 67, he had missed both his initial enrollment and the chance for a special enrollment. He had to wait until the general enrollment period, sign up then, and pay a 20% late penalty on his Part B premiums for the rest of his life. That's an expensive mistake. These enrollment periods matter so much because healthcare isn't just about convenience, it's about financial security. Medicare provides a safety net, but only if you use it correctly. Missing deadlines or failing to review your plan every year can cost thousands of dollars. On the flip side, being proactive can save you money and give you peace of mind. Another important point, even if you don't take any prescription medications, it's usually smart to enroll in at least a low-cost Part D plan during your initial enrollment period. Why? Because if you skip it and later need prescriptions, you'll face that lifelong late enrollment penalty. Many people think they can wait until they need drugs, but that's not how the rules work. A cheap Part D plan can act like insurance against future costs. You might also be wondering about Medigap plans, also known as Medicare Supplement Insurance. The enrollment rules for Medigap are a bit different. Your best window to buy a Medigap plan is during the 6 months after you first enroll in Part B at age 65 or older. During this time, you have guaranteed issue rights, meaning insurance companies can't deny you coverage or charge you more because of health conditions. After that 6-month window, companies can use medical underwriting, which may make it harder or more expensive to get coverage. So if you want the flexibility of original Medicare with a Medigap plan, it's smart to act during that initial 6-month window. Let's recap the major enrollment periods to keep them clear in your mind. Initial enrollment period, 7 months around your 65th birthday. General enrollment period, January 1st through March 31st each year, with coverage starting the following month. Special enrollment periods, unique situations like losing job-based coverage or moving out of your planned service area. Annual enrollment period, October 15th through December 7th, the main time to change your coverage. And Medicare Advantage open enrollment period, January 1st through March 31st, a second chance for people already in Medicare Advantage. It might feel like a lot of dates to remember, but here's a simple trick. Think of Medicare as having two main seasons. In the fall, from October 15th to December 7th, you can shop around, compare plans, and make changes for the new year. In the winter and early spring, from January 1st to March 31st, there's a chance for people who missed their first shot or who need to fix a choice they regret. The rest of the year, your opportunities are limited to special enrollment periods based on life events. Before we wrap up, let's touch on some tips for making the most of enrollment periods. First, always mark your calendar. Medicare doesn't always send reminders, so take responsibility for knowing your deadlines. Second, review your annual notice of change from your plan each fall. This document outlines what's changing in your coverage for the next year. Third, compare your plan options annually using the Medicare Plan Finder tool on Medicare's official website. Even if you love your current plan, prices and networks can change. Fourth, don't be afraid to ask for help. State health insurance assistance programs, also known as SHIPs, offer free, unbiased counseling. And finally, don't procrastinate. Waiting until the last minute is when mistakes happen. By now, you should have a complete understanding of Medicare enrollment periods, when they happen, what you can do during them, and how to avoid penalties. Remember, Medicare is not one size fits all. Your health needs, financial situation, and lifestyle all play a role in deciding whether you stick with original Medicare, add a Medigap plan, enroll in a Medicare Advantage plan, or change your prescription drug coverage. But none of those choices matter if you miss the enrollment window. So stay informed, stay organized, and make the decisions that put you in control of your healthcare. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more Medicare guides, and share it with someone who's approaching 65 and needs this information. Medicare doesn't have to be overwhelming, not if you understand the rules and take advantage of your enrollment periods. Thanks for watching, and I'll see you in the next video.